For sure. All right. Well, I'm going to hand it over to the both of you. Thanks so much for joining again.
Yeah, for sure. So hi, everyone. As Amanda mentioned, my name is Megan Gibbs, and I am the Director of Customer Success here at MiHIN. Just to give a quick recap on that role, the Customer Success Department is relatively new within MiHIN as of the last couple of months. And we had the opportunity to merge our account managers and our implementation analysts into kind of one role to come together to be a customer engagement specialist position. So truly, we recognize that MiHIN had grown exponentially, and we have a need for this customer success department and model. So a lot of it, again, is just a little bit of a mixture of account management, supporting your implementation requests, and really kind of providing that baseline level of support that should you have a question that may not directly be addressed by our team, we're still that kind of point of contact that can route you to any internal team that you need to work with. And Crystal, I will let you introduce yourself, and then I can go ahead and get started.
Yeah, sure. Hi, I am Crystal Schramm, Senior Technical Business Analyst here at MiHIN, and I help work on the operations for the conformance module, and so I can help you with anything conformance related. It's great to be here.
Excellent. Thanks, Crystal. Okay, so getting started today, we're going to provide a brief overview of who Michigan Health Information Network is, also known as MiHIN. We can give a brief history lesson of conformance and how it came about back in 2014, 2015, and how much has advanced over those years. And then we're going to have Crystal dive right into a demonstration of our MyGateway conformance module. So continuing on, again, we already introduced ourselves, so I can skip this slide here, but Michigan Health Information Network, also known as MiHIN, is the state's designated entity to really kind of improve the coordination of care, right? So we are the single point of contact if you want to send or contribute data or submit data to the state of Michigan, but we're also here to support all of the Michigan-based organizations to exchange electronic patient information, right? So really moving away from having to fax data. And now it's an electronic mechanism where as soon as MiHIN receives that incoming message, we recognize and identify where that message needs to go outbound. So your provider organizations can be connected to those that are providing front-end care, like in the hospitals, and really having that full picture of that patient's longitudinal record history, right? So again, being able to work with multiple organizations to continuously improve healthcare quality, efficiency, and patient safety by supporting the electronic exchange of health information. So MiHIN actually started back in 2010, and we're a teenager, right? We're 13 years old. So I'm not going to go over every bullet point in this timeline, but there has been so much that has happened in those last 13 years. And I've even seen a lot of advancement happen too since I came on board to the MiHIN team back in 2014. So a couple of key highlights, right back in 2014, we had 100 million messages routed through our network. Now, 2023, cumulative, you're talking billions. So it's a ton of data that is constantly coming in and a ton of data that's constantly being routed outbound. Back in 2016, 90% of the ADTs were sent through MiHIN. And I want to say now that our coverage rate for healthcare entities sending ADTs to MiHIN, when you start talking about hospitals and health systems, is at 99%. So we just have some of the surgical hospitals that have yet to connect, but that's something that we're actively working on today. So again, don't want to provide too much emphasis on here because Crystal has a great demonstration for you, but I think this slide gives you a really great overview of how much MiHIN has grown in those last 13 years. So part of the reason that MiHIN was created was that back in the early days, there were what we call end-to-end connections. And I'm very much a layman's terms kind of person. So you think about all of the infrastructure that we have in place, right? And many years ago, it was one single pole and there could be 100 wires coming off that pole connecting to different buildings or houses or whatever it may be, right? So there were tons of connections to one single pole, and it was all over the place. So regardless of who you were talking to, and if it was a hospital, then they could say, I have 100 connections to these outside entities. Well, if you introduce MiHIN into that model, it's a one in, one out kind of, right? So we provision access to all sorts of shared services and shared entities. And really breaking this down, organizations send us data, and we're kind of that middleman to route the data where it needs to go, right? So that limits having end-to-end connections, or having a hospital or health systems to support all of these connections with all the other hospitals and health systems across the state. But then you start factoring in provider organizations and independent practices, right? So MiHIN is here to truly help you engage in electronic data sharing and to make it easy and most cost-effective for any sort of participating organization in the network. So for a little bit of the history of conformance, Blue Cross Blue Shield, BCBSM, has 2 hospital incentive-based programs, right? So some may know it as pay for performance, or what we actually do shorthand, because MiHIN is so big on acronyms, we call it P for P. However, both programs recognize that hospitals that participate are those that excel at care quality, want to find ways to be more cost effective, and also ensure that there's continuous improvement when it comes to population health management. So recognizing that there are different hospitals and health systems across the state of Michigan, right? And everybody has a different way to participate, and you all vary in size. There's essentially 2 programs based on hospital size, right? So you have your large and medium-sized hospitals, and then your small and rural hospitals. So your large and medium hospitals are often referred to as peer groups 1 through 4. Peer groups 1 through 4 have the ability to earn an extra 5% toward their operating costs. There's more involved in being part of that peer group 1 through 4 group, and there's strict requirements that you have to meet. A lot of it is not only do you have to send the data, but you also have to send the data X percentage of time. You have to populate your messages X percentage of time. When you start talking about the small rural hospitals, those are generally referred to as peer group 5. And those hospitals and rural hospitals can show their value to the community by meeting expectations for care, access, quality, and effectiveness. So really it boils down to send the data, right? We'll give you the conformance points if you just start sending the data. And that might be within 1 or 2 years, or even a couple of years down the road. You'll have to meet the requirements similar to a peer group 1 through 4 to say that you not only have to send the data, but you have to send it X amount of time. So there are much less stringent rules when you start talking about peer groups 5 or your smaller hospitals and how they participate in the P for P program. Furthermore, I think it's also important too that MiHIN places a very strong emphasis on the data quality that not only comes in, but then the data quality that we send out. And for context, I pulled this slide from one of our onboarding presentations when we are onboarding an organization to send ADTs to MiHIN to ultimately be routed outbound to our participating network. So there's multiple phases throughout the process, but the key one that I wanted to focus on and with the group today, and it reiterates back to what Crystal is going to discuss, is regarding data quality assurance. Sometimes we call that DQA. There's no really great way to say it, but I think what kind of resonates with everybody is that we don't want to have a garbage in, garbage out model, right? We are here to work with you. We're here to support you. We're here to engage in conversations with your vendors to say, here's what we need for the sending organization to be in conformant and have excellent data quality, right? So you don't need to meet all of the criteria, but we want to make sure that most of the criteria, is met before the data is sent to outbound receiving organizations. Part of the reason that we make sure that we go through this process with our sending organizations is that because we do receive feedback from provider organizations sometimes, and they'll say, hey, can you reach out to so-and-so? You know, they're not including the discharge date or discharge location in their ADTs, and it's really impacting our workflow, right? We're very willing to assist in these conversations and going back to that sending organization, say, hey, you know, somebody's asking for you guys to include this information in your data. Can you do it? How much work does it take? What kind of fields should you, or data elements that you should be including in these fields? So we're here to support data quality assurance. We see the importance of data quality assurance. And, in the last couple of years, we used to send manual reports that provided a high level overview of what conformance looked like. And now we have this fancy tool, the conformance module, that allows users to log in and view their conformance data, but then also pull non-conformant data, right? So we made it much easier to access the information that your organization is sending. So Crystal's going to dive into this a little bit deeper during her demonstration, but this is kind of just a baseline of what you can see upon logging into the conformance module. So right now we offer the ability to review ADT reports, lab reports, and MedRec reports. However, I think it's worth noting that your organization must be sending these data fields, these message types if you wish to review the data within the conformance module. So again, I don't want to steal Crystal's thunder, but there's different options that you can utilize within the various levels of reporting, right? So within the ADT conformance report section, there's 4 different reports essentially that you can review. You can review conformance overview for the hospitals, specific hospitals, skilled nursing facilities that you might have access to. And then where you see your ADT fallout report is where you have the ability to view non-conformant messages. Lab conformance is similar, just like ADTs, excuse me, where you have the ability to review how you are in conformant for the specific fields that were set forth by Blue Cross Blue Shield. And then the same thing for MedRec as well. So you have the ability to download non-conformant CCDAs and take that back to your internal teams and do some sort of investigative or educational processes and workflows to make sure that your messages are conformant when they're sent to MiHIN. So this is kind of what I was talking about back in 2015 when we used to send these reports. This is how they looked, right? Lots of red, lots of yellow. So fields populated translates to how often the data was included in the specific required fields. Fields mapped translate to whether or not the data elements were identified in the mapping tables that these organizations provide to MiHIN. Mapping table really just kind of tells us what to expect in the various ADT segments of your ADT messages. And the enhanced fields is how often that data was populated to and that the data is useful, right? So you fast forward from 2015 in, I believe, April, and then to December. So this was one organization's progress over that course of time that we were working with them to become in conformant with their data. So fast forward from 2015 to what it looks like now. This is what any end user will see upon logging into the MyGateway conformance module. So you have the ability to review your overall conformance score, but then we also provide some helpful insight as to what these segments are, right? So if I'm a new person, first day on the job, kind of have an understanding of what an ADT is comprised of, but maybe I don't, I can see what each of these fields are. So then I can take it back to the necessary teams to say, hey, we're kind of falling short in PV 117, that's your admitting physician field. What can we do to fix this? But then again, too, this is an opportunity and an educational aspect, I think, to call out to say that this organization went from a score of 81% to 100%, right? They were able to review the conformance data in the conformance module at their leisure, download those non-conformant examples, and then it overall increased their conformance score to 100%. So I know I went through that kind of fast, and don't hesitate to reach out to me directly if you have any questions or put them in the chat, but I wanted to make sure that Crystal had enough time to provide an overview of the conformance module. So Crystal, I'm going to stop there and stop sharing, and I will let you take over.
Awesome. Thank you, Megan. Thank you for providing that history. Very, very helpful. All right, now let's see if the technology will work for me and I can share my screen. Let's see. Oh, looks like it's working. Okay, let's see. Can you see my screen?
Looks good.
All right. I have 2 screens up. So if I'm talking to you guys and I'm looking over there, it's because I'm looking at the screen. So sorry if I'm doing that. All right, so I'm going to jump right into it. So this is once you log on and you get to the initial screen, then you go to the conformance reporting section. And then you go to this little hamburger thing over here, click on it, and there are 3 sections, as Megan said. So let's start with the ADT. And it does take a few moments as it downloads each of the sections. And there is one additional report that we had added, I think since Megan had shown that slide, that is called the ADT mapping analysis. And that's related back to that ADT table she was talking about. And so it shows a breakdown of codes or things that you might have mapped, that you might not have mapped correctly in your table that you didn't send through, or things that you need to update. So I'll show that too when I get to that report. But I'm going to start with the basic one, the simple one for hospitals, because usually we do it, usually each hospital is individually working on their conformance. So it makes sense to do it from that. Our demo environment is not as up to date as I would like. So I am picking a little bit on Allegan, or I think there's an Ascension hospital in here. I don't know if anyone from Allegan or Ascension is on the call, but if you have any questions, I'm not going to show any PHI or anything. I'm just using it for the demonstration for the report, but please feel free to speak up if you have questions or if you're concerned, you know, if I'm showing your organization, but there's nothing bad I'm showing. It's just the data itself, which is you're aware of your scores. So this first one is the overall ADT conformance report that Megan showed. And it does take some scrolling, but it walks through. So right now it shows last 7 days. So when you have these periods of interest picked out, last 7 days, previous month, previous week, it is showing those. So these dates right here is just the default date it shows. But if you're ever concerned about that, or you can't remember that logic, you know, for my peace of mind, usually people look at these on a month-to-month basis. So you can always easily either use the drop down or change it here. So we could change it to July. And then I'll change it to today's date. So their overall score is the 92.3. And then each section, as Megan said, is first you start with the population rates. So is it being routed, or is data actually being put in the field when you're sending the message over, or is it just blank? This next section is the mapping and normalization. So based on what you have listed in your mapping table, are you showing that particular field? So if you have something for, let's say, PID 22, which I don't know these off the back of my head, so I'm going to use my cheat sheet here. It is PID 22 is ethnic group. So what ethnic groups do you have mapped in your EMR system that you've told us that you assigned to? Did you suddenly add one that maybe wasn't listed before and you didn't update your mapping table? That might show a discrepancy here. And then if you scroll down, getting into these are the diagnosis rates. So these show the coding standards and the population rates for these DG13 and DG132. I believe that's the diagnosis, and the description. Yeah, the diagnosis code, and then this is the diagnosis code description. And then the PV17 is the attending doctor. If you're ever unsure what these things are, you can look over here on this screen. And then you can also reference the Blue Cross guide, which has a list of each section and what they are. So anything that is gray is currently not being scored in the conformance period, and anything is red is probably something that is below the threshold for that specific time period. In each of these sections, we are working so you can do a quick snapshot of all your conformance and download at once. But until we get that in place, at this point in time, you can do each section. So you could download it by hitting these 3 dots right here, and you can export to a CSV or an Excel. And then you can open it up that way. just to give you an idea. Some people like working in Excel better, so it just depends on how often you're logging in here and want to use this. And then, so as I said, each of these things on the side gives you the totals. It does it by a one-to-one. So it's however the total amount of fields in this page or what this total amount is scoring. And if you ever have questions about the scoring logic, you can always check with Blue Cross with their Health Information Exchange team, Brad Whittle and Zara Fritz. They work on this very closely with MiHIN, and so they can help answer those questions too. And we work very closely with them to make sure that you guys are getting what you need. So this just gives more general information. And on this next tab, it's another way to view it. So if you want to look at it by trigger type first versus having it broken down that other way, you can look at it this way. And some people like doing this, and then you have to scroll because there's a lot of categories. But one of the other things it does is it helps you with total amount of messages, you know, and it has inpatient, and emergency, things like that. So those are things that some people like digging into more once they're digging into specific fields of their data. I'm going to go to this ADT mapping analysis next. You get this error, that's because it timed out. Sometimes it does that when you switch from reports. You can always let us know about that too. Let me get back into this. Yeah, we're consistently working on the timing out issues. There's a lot of data in here and a lot of reports. So sometimes those little things pop up. So we're still trying to work on those on a constant basis to maintain and operate this.
Real quick, Kina had put in the chat that she's confused to which portal she should be using, My Gateway or the UPHIE. She's been using UPHIE, but she sees you're in MI Gateway. She has access either way, but wondering if one is better.
I was just responding to this in the chat, but I wanted to clarify too that the My Gateway conformance module is what participating organizations will use to view their data quality that they send to MiHIN. The Up High My Gateway module is for organizations that are part of the Up High network to view transition of care data. So that's where you'll see your patients' your patients' ADTs or CCDs within the Up High My Gateway module. But the module that Crystal is sharing right now is strictly related to data quality conformance for what the hospitals and health systems and SNFs are sending to MiHIN.
Could you type that into the chat still?
Absolutely.
No, that was a lot. I'm gonna need to.
Well, and I do think
that.
I think that Up High has a separate login that's literally identical to our My Gateway one, because someone said in the chat you could see your conformance in that. Is that correct?
I think it's just that they have access to Up High. Oh, she said she can see them in Up Highs.
Yep, they have a separate login, I believe, that they actually literally, it's basically literally My Gateway, but it's branded with Up High Force, like, so they should be able to see conformance in there.
Perfect. I'll recap that in the chat as well.
Awesome. Thank you. And thank you for that question. That's a great question. And I didn't point that out. And we have a lot of critical access hospitals up in the UP. So thank you for pointing that out. The other one, so this ADT mapping analysis report, it's based on the ADT mapping table that you send to MiHIN. So it's unique for every organization. So if you wanted to look at, let's say you wanted to see, are you sending everything correctly that you told us you would be sending in PID 8? So it looks like for PID 8, this must be patient and gender. These must be the values that they have in their mapping table. So they're sending them. And then if you were to say non-conformant, so it looks like 20 messages for, now I realize this is a older time period, but for the sake of this demo. So it looks like for this time period, there were 20 messages that came through where there was no gender listed in that field on those messages. So that's what this is telling you. So then you can go back during that time period and you could use the fallouts to figure out, okay, why aren't we sending the gender on those? What's going on? What's happening with the messages we're sending? We're missing it somewhere. Why are they blank? You know, is it an emergency department visit? Is it a last minute thing? What's going on? So once you want to use this tool along with the fallouts, so you can identify those areas to dig in deeper in. But I advise people to kind of play around with the mapping analysis, because that's a fairly new report. And so we're still looking at all the different things you can do. For the ADT fallouts, you go to the ADT fallout report. And let's say, I'm just going to pick some dates here. So let's do 7/10. So you could sort it by the type of message ADT types. So you could do select all, or you could pick individual ones. And then a popular one is diagnosis code, right? That's something we all struggle with for various reasons. Not because we don't want to get it in there, but because it's hard to do with technology and real live visits. So you want to see, not only can you see non-conformant messages, but you could see conformant. And you might think, well, why would I want to see the messages that I'm sending you correctly? But it actually helps you. I found when we pull up, because we'll pull up a conformant one and a non-conformant one side by side, and sometimes you can immediately see why you were missing something and where it was happening. So I like to point that out to people, that I would recommend using both as you're troubleshooting and investigating things at your hospital. So you could do find conformant messages, and then you could click this and it will download all of these messages, or you can unclick it. And if you wanted to do that, you just hit this download button right here, or you could click just the one. And
Deb Sherman, I work at McKinsey Healthcare.
Yeah.
I know my employee number, my social security number, my email address, but I don't know the hospital code. How do I get that to get my paycheck stub?
I think you might be, you're not on mute. All right, I'm going to keep going with the demo. So once you click each individual message, then you can hit download. And then it will actually open up into a text document. I'm not going to open this because, and it says non-conformant, but you know that when you downloaded it, you selected conformant. I think that just defaults when you hit download, because it's all for all fallouts. But you would open this message and that will have PHI in it. So I'm not going to do that. But you open that message and then you could see the raw ADT message that you sent MiHIN. So we could do the same thing with, you can do it by non-mapped and non-populated. So really non-mapped and non-populated are non-conformant, but we're trying to help you by saying, okay, was it that the data wasn't sent or it's not mapped? We're trying to separate it out for you so you can dig in a little bit deeper. So you see there's one here that wasn't mapped. And then let's say non-populated, looks like they were all populated for that time period. So that's a good thing. But again, you could do it by each type. So you can go back to your ADT conformance score and look at where you're not hitting the mark, and then come in here and start sorting by that and start digging in. I've been with hospitals on call when we've had the technical person or we'll have the clinical person. And sometimes it's a matter of something is not coded properly on your side, so it's a technical issue. Sometimes it's a matter of it's a clinical issue. Maybe there's training by staff that they're not entering something correctly in the EMR. Maybe they're using, maybe they're entering free text on a dropdown, and that dropdown might have auto-populated the data that would have been sent to us. So it could be a number of things that can pop up when you're investigating these. Next, I'm going to show you the MedRec reports. So when Megan, I think people are chatting, but I think you're on top of it. So I'm going to let you take those. All right, awesome. So the MedRec reports show if you're sending exchange CCDAs to us. So once this gets in here, it'll just take a second. I can show you, we have a report that shows you the conformance on your sending levels for CCDAs. And then you can also look at the fallouts. Notice there's not as many reports built out for MedRec because when all of this started with MiHIN, we started with ADTs, and they are, in retrospect of like the size of messages, they're a lot smaller than a CCDA, which is a giant document really when you're looking at it. And so it takes a lot more for organizations to start sending those in. I don't know what all the timeout settings are. Let's try this again. Actually, I'm gonna go back this way. All right, here we go. Okay, so this one, it's a little bit different. Same type of concept though. You're just looking at the fields and what your scores are. So the fields that are not have a color, they're not being scored for this time period. And then the fields that are red are because they're below the threshold. Something really important that I want to note for critical access hospitals, though, the peer groups 1 through 5, or peer groups 5, is that when we originally built this conformance module, it was based off the thresholds for performance groups 1 through 4. There's a lot of scoring logic that goes into it. And so some of the scoring logics are the same for peer groups 1 through 4, and some are different for 5. So right now, if you're looking at it and you're thinking, oh, I'm not meeting my thresholds, I would pay attention closely to that Blue Cross document for peer groups 5, because even if something is red over here, like let's say, if you scroll down, so like this discharge medication, I believe for peer group 5, it is, these are, let me double check. I'm not sure. Let me see. I'm looking at ADT. Give me 1 second. Oh yeah, 75 hospitals will earn 0.75 points per quarter by transmitting and exchange CCDA messages. So for peer groups 5, it's not as broken out as what it is for peer groups 1 through 4. They have certain thresholds that they need to meet. I believe you guys are getting scored on sending the CCDAs. We can clarify that with Blue Cross if we need to. But my point of saying all of that is I don't want the red and green to alarm you. Just recognize that that's something we plan on building into it more, because what I'd like to do is have it so if a peer group 5 logs in, it matches to identical to what Blue Cross is having you do versus 1 through 4. But the reason we built it that way is because, like Megan said, eventually the 5s move on to do what the medium and larger size hospitals do. So it's a learning curve for us too, because we've never built something like this before. So we're trying to work out all the kinks with the scoring logic too. So that's why you might see things that you're like, I'm not, you're not sure why it looks like that. But regardless, you could still use this as a tool to look at your scores, because this is exactly what Blue Cross is looking at when they're scoring you for your HIE component for the pay for performance. So they're looking at they're logging in and looking at the exact same thing that you are. So if you scroll through here, you can look at all the different types. Again, same thing, date filtering type logic. And then for this one, we just broke it down a little bit differently, and you can download the different sections. Again, we're working on trying to build a bigger report view, but for now, this is how it is. But you could break it down. We have patient information, attending provider, visit information, discharge medication section. So there's like those big chunks of the CCDA sections. And so we just took it and put each of them into a separate view in case you just wanted to focus on, oh, I just want to look at the patient fields for my CCDA, because I right now that's the thing that we need to focus on right now. So this just gives you a different view to do that. And it's kind of easier than scrolling through all that, especially if you don't want to look at everything at once, because that can be a little bit overwhelming, especially when you're digging into your CCDAs, because there's so much data in that. These are for the visits. So same thing, you can look at it by this section. And then the provider and discharge section, you can look at those together too. So like these are all the discharge medication section. That's something that's everyone struggles with, because we can't always get all the data right when people are coming into the hospital and they might not be discharged on medications, but there's certain exemptions that can be made. And in our reporting, conformance reporting user guide, there's a lot of rules in there that we walk through, and we talk about, you know, well, what if we had this scenario? We have an FAQ at the end. So there's a lot of helpful tips and tricks in there. And you could always reach out to us in our help desk. We have a large staff that works on conformance and can help walk you through any questions you have. I pretty much learn something new every day on conformance, because it is so intense, and there's just lots of layers to it. And then this one doesn't have the color. It's literally just to show you all of your scores at once in case you didn't want to look at that other view. This was another way we thought of until we were able to build that larger snapshot out of another way we could do it. So it does have some more scrolling, but it has all of the same sections that first tab has. And then if you didn't want to look at it and download each section separately, you can come over here and download it this way. And then it has everything in there. Just another way to view it, really. So now you're thinking, now you want to go into the MedRec fallout. So let me show you that. So let's look at, let's say last week. Let's do the medication code, and we can do conformant. So a little bit of a different view, but the same concept as the ADT fallouts. So right away, it shows you the file ID, the encounter ID, which matches what the encounter ID is in your EMR. And then it says if it's conformant for that field. So for all of these CCDA messages, the discharge medication code was conformant. And you can download each, again, in the same way that you would download the ADT files. And again, they do contain PHI, so just make sure who's ever downloading them in your system is, you know, aware of that. And then if you wanted to look at non-conformant, you could do that. Let's see if we have any. So there are some, and it looks like there's several. So, you know, if you don't want to get all these at the same time, it depends on how often you're logging in here. You can look at them every day, every week. It just, whatever works for what your staff need to do. And then wanted to show you the lab report. This is the newest one that we have. Labs were just added. The lab fields were just added by Blue Cross this past year, I believe. So organizations are getting credit for sending lab data. So we just built out this initial report. We don't have any fallouts for labs yet. I'm sure that's something that will come in time because people want to figure out how to get their scores higher. So right now we just have the one report. And these are the different ones that are being scored. It's pretty. And then anything, again, that is not, these ones are not being scored. So that's why they are gray. But a lot of times those ones that are gray might be ones that would be scored in a future year by Blue Cross. So that's something we try to start tracking for you in case you want to see how you're doing, which is another reason why they're in the report. And then you can change the dates. And then this one shows, it's just another way. It's for basically if like Blue Cross wanted to log in, they can see all the hospitals, so they can come in over here and look at everybody. Now, if you're only one hospital, you're only going to see yours, so it won't be much different. It's just going to look the same thing you saw on the other screen. but that's why this one's in here. And that's one of the reasons we have the overview reports a lot, is because people are trying to look at a lot of hospitals all at once. So that is the lab report. I'm trying to think. I think that kind of wraps up the demo. But I'd be happy to take questions. I haven't been monitoring the chat, so I see Megan's keeping tabs on that, but whatever you guys want to do for the meeting, if you have time, whatever you need me to do, Amanda, I can do.
Yeah, we'll stick around for just a little bit to see if anyone has any questions. No one has any questions? All right, well, I just put into the chat the survey for the webinar for this afternoon. I want to thank Megan and Crystal for joining us today and putting on a webinar. It was very informative, and I greatly appreciate it. So if there isn't any questions left, we will give everybody back 12 minutes of their day.
Thank you for having us crash your meeting today. And Amanda, you have my slides now. Feel free to share those with the group too. And on the very last slide, you will find my email address along with Crystal. So please don't hesitate to reach out if you have any questions.
Yep, I will send those out to the group this afternoon. And we will also probably put those on our MCRH website, and hopefully get the video up here within the next couple of weeks as well. All right, thank you guys. Have a great afternoon.
Thank you so much. Have a good week.
Thanks, you too. Bye-bye.